Hello friends, welcome to the Anatomy Hub. Today we'll discuss about the Norma basalis, mainly the external view. So here we'll see that there is the presence of the skull and the inferior part of the skull. So when the intact skull is viewed from the below, the limits of the oral cavity that can be seen, and its roof is formed by the hard palate and its wall by the upper and lower teeth that embedded in the alveolar process of the maxilla and the mandible. The posterior border of the mandible that can be followed upward to the temporomandibular joint between the head of the mandible and the base of the skull, and the ramus of the mandible can be seen as the lateral wall of the infratemporal fossa. Within the skull here, with the presence of the mandible and the cranium. So here we have just removed the mandible. The mandible removed, the Norma basalis is seen to include the upper jaw and the teeth, the hard palate, the posterior nasal aperture or the posterior nares, also termed as the choani from the Greek meaning of funnel, and the bony nasal septum between the two nasal cavities, the prominence of the cheeks and the zygomatic arches, the mandibular fossae that lodge the head of the mandible, the entrance and the floor of the external auditory meatus, and the foramen magnum through which the brainstem becomes continuous with the spinal cord. And here we'll see at this position, you can see that the Norma basalis can be divided into three parts, as I have drawn here the two lines. Anteriorly, here you will find the maxilla and the palatine bone, and some part of the zygomatic bone over here, and that comprises the anterior part. So this division is only for the convenience of our study and to understand the skull in better way. And here we will get the middle part, and here we will get the posterior part. So just draw a line in such a way that it will cross the two palatine posterior border of the palatine bone, and another line that is can be drawn at the anterior border of the foramen magnum by passing to these two condylar process of the foramen magnum. So the bones, here we'll find the maxilla. The plural will be the maxillae that forms the upper jaw and the alveolar arch and the anterior two-third part of the hard palate. Then here we'll find the paired palatine bones from the posterior one-third part of the hard palate, which forms the posterior one-third part of the hard palate. The unpaired femur forms the posterior and lower part of the bony nasal septum. The paired zygomatic bone that you can see here from the prominence of the cheek and anterior half of the zygomatic arch on each side, and here you will find the unpaired sphenoid bone. The Greek word spheno means wedge, so it is wedge shaped that actually contributes a strip across the entire base of the skull anterior to the occipital bone and temporal bone. In the external view, the sphenoid that is seen here to send a pterygoid process uh, downward on each side behind the end of the superior alveolar arch. Here you will find the unpaired occipital bone that constitutes the central region of the posterior half of the base of the skull, and here you will find the paired temporal bones. So the paired temporal bones form the remaining posterolateral portion of the skull base, and each that sends a projection the petrous pyramid. Petrous means hard or rock-like structure. That's why it is the petrous part, and towards the midline that intervenes between the sphenoid and the occipital bone. The principal features that you will find here, that is the main sutures. So here you will find the intermaxillary suture that lies on the midline of the hard palate between the two maxillae. The median palatine suture that lies on the midline of the hard palate between the left and the right palatine bone. The transverse suture that will be found over here, that extends horizontally across the hard palate between the right and the left maxillae and the palatine bone. Here you will find the two paired sphenohumerine suture that run anteroposteriorly between the sphenoid bone and the humor, and that is actually paired in nature. Here you will find the spheno-squamous suture that extends anteroposteriorly between the sphenoid bone and the temporal bone on each side of the skull that you can see here. Here you will find another suture. This suture is your petrous part of the temporal bone and the sphenoid bone. So it is known as your petrosphenoidal suture, which lies between the petrous part of the temporal bone and the greater wing of the sphenoid bone. Its width varies greatly, and in some skulls it appears as a fissure rather than the suture. And here it is not clearly visible, but the lower end of the lambdoidal suture that can be seen on each side between the parietal and the occipital bones. The fissure can be traced downwards and medially into the occipitomastoid and the petrooccipital fissures between the occipital bone and the petrous part of the temporal bone respectively. Here you will find the neurovascular exit portals, that is mainly here you will find the foramen magnum. So the foramen magnum means great, so it is a great hole that actually lies on the midline on the occipital bone. Through it, the brain stems is continuous with the cervical spinal cord. The vertebral arteries that pass upward through the foramen magnum on their way towards the bacillary artery, and it forms the circle of Willis. And the spinal accessory nerve also ascend from the upper cervical cord segments into the cranial cavity through this foramen magnum. Then here on each side, the cervical entrance to the carotid canal leads to the internal carotid artery into the petrous portion of the temporal bone that you can see here, and the canal which runs parallelly to the long axis of the petrous pyramid that transmits the artery upwards into the cranial cavity towards the circle of Willis. The artery is accompanied by the internal carotid nerve that you can see the sympathetic plexus, a bundle of postganglionic fibers that originating from the cells of the superior cervical sympathetic ganglion. Here you will find the jugular fossa. Here you can see the jugular fossa. So the jugular fossa that lies on the petrooccipital suture immediately posterior to the carotid wall or carotid canal, and the fossa that lodges the jugular bulb, the dilated upper end of the internal jugular vein which communicates with the intracranial system of the dural venous sinuses through the jugular foramen. The foramen can be seen from below within the skull, and it also transmits the glossopharyngeal nerve, vagus nerve, and the spinal accessory nerves from the cranial cavity into the neck. Here, just lateral to that, here you will find a foramen, and here you can see this the foramen. This foramen is the stylomastoid foramen. The lower end of the facial canal on the temporal bone that lies lateral to the jugular fossa behind the base of the styloid process. It transmits the facial nerve and the stylomastoid branch of the external carotid system. Here you will find the foramen spinosum over here at the greater wing. So the foramen spinosum that lies at the base of the spinous process, that you will find over here the spinous process, and here you will find the foramen spinosum. The foramen spinosum that lies at the base of the spinous process of the sphenoid bone, anterior and across the posterior-sphenoid fissure from the carotid canal. The foramen transmits the middle meningeal branch of the external carotid artery into the cranial cavity. The artery is accompanied by the postganglionic plexus originating from the superior cervical sympathetic ganglion and by the nervus spinosus, that is a recurrent meningeal branch of the mandibular division of the trigeminal nerve. Then just anteromedial to that, here you will find the foramen ovale that lies anteromedial to the foramen spinosum and at the base of the lateral pterygoid plate of the sphenoid bone. So the foramen transmits both the mandibular division of the trigeminal nerve and the lesser petrosal branch of the glossopharyngeal nerves from the cranial cavity into the infratemporal fossa. So here you will find the foramen ovale that lies anteromedially to the foramen spinosum, that you can see here at the base of the lateral pterygoid plate of the sphenoid bone, and the foramen transmits both the mandibular division of the trigeminal nerve and the lesser petrosal nerve, that is the branch of the glossopharyngeal nerve from the cranial cavity into the infratemporal fossa. The accessory meningeal branch of the external carotid artery that also enters into the cranial cavity through this foramen. Here you will find the greater palatine foramen. So the greater palatine foramen that actually exit of the greater palatine canal that lies at the posterior lateral angle of the hard palate just medial to the last molar tooth. The foramen that transmits the greater palatine nerve and vessels. The nerve is a branch of the maxillary division of the trigeminal nerve, and the artery is derived from the maxillary branch of the external carotid system. And the vein drains to the pterygoid plexus, that is a tributary to the maxillary vein. Then just behind to that, here you will find the lesser palatine foramen that lies behind the greater palatine foramen, and it transmits the lesser palatine nerve and vessels to the short palate, and the nerve is actually branch of the maxillary division of the trigeminal nerve, and artery is from the maxillary branch of the external carotid artery, and the vein that drains to the pterygoid plexus. The lesser palatine foramen may be small or large or single or multiple, that depends upon from person to person. Then here you will find the incisive fossa that lies on the intermaxillary suture just behind the medial upper incisor. It receives the left and right incisive canal. Inside you will find here descending through the hard palate from the nasal cavity. On each side the canal transmits the nasopalatine nerve from the above and the greater palatine vessels from below. The nerve is branch of the maxillary division of the trigeminal nerve, and the artery arises from the maxillary branch of the external carotid artery. and the vein drains to the external jugular via the pterygoid plexus. Then we'll see the prominent landmarks and the reference to some of the points. A number of important landmarks can be appreciated only with the mandible in place, but here we have removed the mandible. Here we will find the spine of the sphenoid, and the styloid process will be over here, and many other landmarks that can be seen more clearly once the mandible will be removed. So here you will find the pterygoid process that projects downward from the inferior surface of the body of the sphenoid bone just behind the alveolar arch of the maxilla. The process bears the bony medial and lateral pterygoid plate, which projects posteriorly, enclosing the pterygoid fossa between these two plates. The medial pterygoid plate that forms the posterior extremity of the lateral nasal wall, and the pterygoid hamulus that you can see here. Hamulus means little hook that curves downward from the medial pterygoid plate to anchor the upper end of the pterygomandibular raphe, a cord of connective tissue on which the muscles of the cheek and the nasopharynx meet each other. The boundaries of the infratemporal fossa that you can see here, that becomes obvious if the outline of the mandibular ramus is projected into the base of the skull. The maxilla that forms the anterior wall, the lateral pterygoid plate over here, its medial wall, and the ramus of the mandible that we have removed here is the lateral wall, and the base of the skull over here, the greater wing mainly, greater wing the sphenoid that makes the roof of the infratemporal fossa. Then what we'll find here is a cartilage auditory tube that is not visible in a prepared skull, is lodged in and fills the groove between the petrous part of the temporal bone and the greater wing of the sphenoid bone, and the roof of the groove is the petrosphenoidal suture, or you can say the fissure, that referred earlier as a fissure, but now it is, you can say it is a suture, petrosphenoidal suture. So this cartilaginous and bony parts of the tube, auditory tube, are continuous at the posterolateral end of this groove. Then here you will find the foramen lacerum. Actually it is lacerate means tear, derived from the tear, the Latin word, that lies at the junction of the petrous part of the temporal bone over here and the sphenoid and the occipital bone. Here you will find the occipital bone, petrous part of the temporal bone, and the sphenoid bone. So meeting point of all this that makes a whole here is known as the foramen lacerum. So this actually jagged aperture that doesn't exist in life. It is formed after the death, when the cartilaginous tip of the petrous temporal bone disappears and varies greatly in size and shape from the skull to skull. The only structure to pass through the thickness of the skull floor here are a small emissary vein and the very small branches of the ascending pharyngeal artery. Then here you will find the mandibular fossa, that is the temporal part, or you can say the temporal bone contribution to the temporomandibular joint over here, and that lies behind the posterior end of the zygomatic bone, posterior end of the zygomatic arch that you can see here, and in front of the external auditory meatus. Then here you will find the styloid process. So the styloid process, the Latin name stylus or Greek name stylos, means the pillar that projects downward and forward from the temporal bone behind the external acoustic meatus. So here you will find the styloid process that projects downward and forward from the temporal bone over here, that you can see behind the external auditory meatus and the temporomandibular joint. So the process that anchors the stylohyoid ligament and the extrinsic muscles of the tongue and the pharynx, that is your styloglossus and stylopharyngeus muscle. Then here you'll find the mastoid process. So the mastoid process of the temporal bone that lies immediately behind the external auditory meatus, that you can see here because the tympanic plate, and here you'll find the external acoustic meatus, and just behind to that here you'll find the mastoid process at the lateral margin of the norma basalis. Then here you'll find the foramen magnum that lies on the midline. It provides the communication between the cranial cavity and the vertebral canal. So here we will find the foramen magnum. Magnum means great that lies on the midline. It provides the communication between the cranial cavity and the vertebral canal by the occipital condyles, and that you will find over here, and which articulates with the first cervical vertebra, that is the atlas. Here the occipital condyles that flank the anterolateral margins of the foramen magnum. They articulate with the first cervical vertebra. And here you will find the anterior margin of the foramen magnum is known as the bastion. Bastion means Greek word basis, means a base. It is a craniometric landmark on the midline at the anterior margin of the foramen magnum. So this is your bastion, and just behind to that here you will find the opisthion. So opisthius means posterior, is another craniometric landmark that opposite to the bastion on the midline of the posterior margin of the foramen magnum. So the external occipital crest that you can see over here, often it is faint in nature and extending along the midline from the opisthion to the inion and the external occipital protuberance that you will find over here. So the crest and the protuberance that anchor the ligamentum nuchae to the skull, and inferiorly the ligament is attached to the spinous process of the cervical vertebrae. The inferior nuchal line that you can see over here, this is your actually faint in nature, but you will find in other skulls. So this inferior nuchal line is a transverse ridge that extending laterally from the midpoint of the external occipital crest. Here you will find the rectus capitis posterior major and the minor muscles that ascending from the spinous process of the axis and atlas, attached over here, attached to the skull between the foramen magnum and the inferior nuchal line. So at this point you will find the rectus capitis posterior major and the minor muscles that we will see in a while in a chart. The superior nuchal line that you can see over here, so this is your superior nuchal line, that is actually the transverse ridge extending laterally from the midpoint of the external occipital crest. The superior nuchal line extends transversely from the external occipital protuberance towards the mastoid process that you can observe here, And here you'll find the semispinalis capitis and the superior oblique muscles ascending from the cervical and the upper thoracic vertebrae to attach between the superior and the inferior nuchal line. In this area, you'll find the trapezius, sternocleidomastoid, and the deeper splenius capitis muscle that all attach to the superior nuchal line. So here you can see the attachments. Over here, all these red marks, they are actually origin of the muscle, and the blue in color, they are insertion in nature. So here you will find the semispinalis capitis insertion, the rectus capitis posterior minor, and here you will find the rectus capitis posterior major. Here you will find the obliquus capitis superior, and here you will find the longissimus capitis and the splenius capitis over here, and at this point you will find the longissimus capitis, splenius capitis, and outside to that here you will find the sternocleidomastoid muscle. And in between that, here you will find this is a mastoid process. So here you will find a notch over here. This is the digastric notch. There you will find the origin of your digastric muscle, anterior belly of the digastric muscle. And here you will find the styloid process. From here you will find the origin of the stylohyoid muscle, and you'll find the styloglossus muscle, stylohyoid and styloglossus muscle, and origin. And here you will find the levator belli palatini from the carotid canal and the petrous part of the temporal bone. Here you will find the tensor belli palatini and the levator belli palatine from the petrous part, tensor belli palatini from the sphenoid bone over here. And here you will find the middle pharyngeal constrictor muscles that find over here. And here you will see the origin of your lateral pterygoid muscle, and here you will find the medial surface of the lateral pterygoid plate that gives origin to the medial pterygoid muscle, and from the inner surface of the zygomatic arch, here you will find the origin of the masseter muscle over here. And here at the fossa between the lateral pterygoid and medial pterygoid, here you will find the tensor belli palatini. Then at this point you will find the trapezius muscle that is also takes the origin over here, sternocleidomastoid muscle that gets insertion over here. And here at this point you will find the tubercle. So this tubercle is the pharyngeal tubercle, where all the constrictor muscles that unite together makes a raphe, is known as the pharyngeal raphe, that attaches to here at the bacillary part of the occipital bone to this tubercle, is known as the pharyngeal tubercle. And just side to that, at this point you will find the rectus capitis anterior, and anterior to that here you will find the longus capitis muscle. So this is the all about the norma bassalis. So thanks for watching. Please like, share and subscribe to get the new videos. So thank you.